G'day. In this video, you will come to understand why the PSA blood test is important in discovering and managing prostate cancer. I am not a doctor, so this is just my understanding. Always check with your doctor. Just this year, I have spoken to a man with a prostate the size of a walnut, to a man with a prostate the size of a tennis ball, to a man with a prostate the size of a softball. Over the past 14 years that I have been having these conversations, I can only recall 4 men with prostates the size of a tennis ball, and only 1 man with a prostate the size of a softball. Many men will have a prostate the size of a walnut at some time during their life. Prostates come in many sizes. There are some rare, extraordinarily large prostates, but at any given age, most men have about the same size prostate as other men the same age. Now we come to Tom, Dick and Harry. Here is Tom's prostate. I have drawn it with 40 healthy cells, because that was easy for me to draw. Just in case you were curious, here is a real, healthy prostate cut across. You can see that nature is not as careful as I am in drawing all the cells the same size. Now Dick was born with a prostate twice as big as Tom's. You might expect that it is bigger because it has fatter cells, but that is not how it works. Big prostates have cells about the same size. They just have more cells. So here I have drawn Dick's prostate with 80 healthy cells, twice the size of Tom's prostate. The final thing we need to know about prostate size is that the prostate will grow steadily every year by about 2.5%. So, here is Tom's prostate at age 25, and here it is a year later at age 26. 2.5% means that for every 40 healthy cells, there is a new one each year. I'll just flash that new cell a bit so you'll notice it. Math wizards will have figured out that 2.5% per year means that the size of Tom's prostate will double in about 30 years. So, at age 55, his prostate will be twice the size it was at age 25. Remember, that's twice the number of cells. This is a chemical, a protein, that every prostate cell releases slowly into the blood. It is called prostate-specific antigen, or PSA for short. Most prostate cells leak this at a steady rate, so that the more prostate cells there are, there will be proportionally more PSA. This is how much PSA had leaked into Tom's blood at his first PSA test. Dick's prostate has twice as many cells as Tom's. So, if Tom leaks about this much PSA into his blood, Dick, with his twice as big prostate, will leak twice as much for his first PSA test. This is Harry's prostate. We will talk about his first PSA test. One day, some time before that first PSA test, one of Harry's prostate cells loses its self-control. It suddenly starts duplicating itself wildly. That's what cancer is. A cell that can't stop madly copying itself. So, this is how much PSA Harry's healthy prostate cells leak. Harry's prostate cancer cells are still prostate cells. They leak PSA in the same way as healthy cells do. So Harry's cancer leaks this amount. But, I hear you say, that's the same total amount of PSA altogether that Dick's healthy prostate leaks. So, how does the doctor, looking at that first PSA test, know whether they are looking at a large, healthy prostate like Dick's or a regular-sized prostate like Harry's that is half full of prostate cancer? The answer is, just by looking at that first PSA test alone, the doctor can't tell which it is, a larger prostate or one half full of cancer. Remember that healthy prostate cells increase their number by around 2.5% each year. That means the second year PSA will be increased by that tiny 2.5%. I will just flash that small amount so you can see the tiny increase in a year. Engineering wizards amongst you will understand that the PSA test, while being highly accurate, is only reasonably reliable. If, like me, you are not an engineering wizard, I think this means that the PSA test can have quite a few decimal places, but the results vary a bit each measurement, even with the same blood sample run twice through the same machine. So, your PSA will vary around 2.5%-ish, and it should not panic you when it goes up or down a bit, so long as your doctor is watching it. Your doctor, looking at your PSA test, expects to see the PSA roughly about the same as last year's, give or take a small percentage. This means that the way prostate cancer is found by PSA test is by having the test repeatedly. Many men choose to have their PSA test around the same date every year. Birthday, anniversary, whatever. I've put the 17th on my calendar here because that's much easier for me to draw than any other number. The doctor wants to know how fast prostate cancer is growing. They know that the time it takes for the cancer to double in size will dictate the type of treatment and how soon it should be done. We saw that this was Harry's first PSA test. But his next PSA test, he had twice as much cancer, and so twice as much PSA added by the prostate cancer cells. But he also still had the PSA from all the healthy cells. Some math whiz figured out a formula that would calculate how much prostate cancer that was in the second test compared to the first, then calculate the rate of growth. If your mathematics does not extend to calculating natural logarithms, there are a number of sites on the web which will calculate doubling time for you. You just enter at least 2 dates and the PSA on those dates. The site will then give you the doubling time. In general, doctors call for urgent action if the PSA doubling time is 3 months or less. On the other hand, if it is 12 months or more, doctors mostly say, wait a while and then do another test. If the PSA doubling time is between 3 and 12, you depend upon the experience and the expertise of the doctor to decide what should be done and when. Earlier, I mentioned that the PSA test is reasonably reliable, but there are some things you should know that can strongly affect the test result. That includes any activities in the previous 48 hours that may stimulate the prostate between your legs. Sexual activity, especially ejaculation, horse riding, bicycle riding, or very strenuous exercise. A small number of men have prostate cancer cells that do not produce much PSA. These cancers are often detected by a digital rectal exam. If your doctor gives you a digital rectal exam, the recommendation is that you should wait at least 3 days before testing your PSA. Urinary tract infection, or an infection of the prostate itself, often delays a PSA test for 6 weeks or so while you are treated with an antibiotic. Medical procedures, like a biopsy, taking samples from your prostate, or cystoscopy, examining your bladder, make PSA tests unreliable for about 6 weeks. Having a catheter up the urethra to relieve retention of urine is known to increase PSA levels measured. Some medicines, like dutasteride, steadily reduce the PSA measurement over the first 6 months to about 50%, while having little effect on the cancer cells. So your doctor will know that your PSA measurement after 6 months should be doubled, and they will be able to calculate how much to allow for it at any time during the 6 months. But a particular problem arises if you are taking complementary or alternative drugs for your prostate. They often contain the same kinds of drugs as dutasteride. The problem for the doctor is that complementary or alternative drugs have very poor quality control. So, your doctor cannot calculate how much those complementary or alternative drugs have reduced your PSA reading without changing the cancer. Your doctor will likely advise you to stop taking these drugs, which, while giving you a false sense of security with a lower PSA, may actually be hiding the seriousness of your cancer. Final message. The annual PSA blood test remains the way we most usually discover prostate cancer in its early stages, where it can be easily and effectively treated.